Karen. Hello, everyone. Good afternoon. Welcome to our COVID-19 update for December 7th, 2021. December 7th, of course, the date that will live in infamy as a result of it 80 years ago, the attack on Pearl Harbor. And our nation came together to fight fascism and respond to that attack, and that's exactly what we still need to do today with regards to COVID, is to come together to fight COVID. You'll hear from Dr. Burstein, of course, and we also have a special guest, Dr. Thomas Russo, from the University of Buffalo Medical School, of course, a internationally known expert on infectious diseases, to talk about what we're seeing and why we're seeing it. And, of course, Karen Gambino from Deaf Access Services is here today to provide the American Sign Language to those who may have a hard of hearing issue. So let's get right into the numbers. The most recent date, which was yesterday, there were 761 new cases for a total of 5,533 new cases in the past week. The average is 580 per 100,000 residents over the past 7 days. That is extremely high. It's nearly 6 times higher than what the federal government, the CDC, declares a region of high transmission, which is of 100 or greater. Positivity rate was 9.5. We'll talk a little bit about the positivity rates in a second, but we have not seen tremendous jumps in the positivity rate recently, and hopefully that's a result of a number of things, including the high vaccine numbers that we have in general in Erie County, as well as the most recently required mask requirement for indoor public settings. Now, this might be a little tough to see if you're watching on television, but this is the regional daily and weekly cases for the Finger Lakes and Western New York regions. This is as of December 5th, not yesterday's data. But unfortunately, the Western New York and Finger Lakes regions have the highest percentage of rates of new daily and weekly COVID cases in all of New York State. And some of these rates are exceptionally high for daily rates as well as for weekly rates. Erie County's been hanging out around 10.4%. 10.8% on a 7-day period. That actually is the lowest rate among all the Western New York counties, which are in the 11, 12, or 13 category. I also include the Finger Lakes number here because there are counties considered in New York's purposes for the Finger Lakes, even though we know they're part of our Western New York region, like Genesee, Wyoming, and Orleans. So you can see the most recent numbers. It's not great in any parts of what would be considered Western New York. And unfortunately, we are the worst when it comes to the rest of New York State. So case data, 5,537 cases last week was the highest weekly case total that we've ever had, and it was an increase of 30% from the previous week. So at any time during the pandemic, we never had a week with this many cases, and it was an increase of 30%. And in recent days, we've had three highest days we've ever seen with cases. On November 30th, it was 899 cases. On December 1st, it was 948 new cases. And on December 3rd, it was 981 new cases, all in a 24-hour period. And this is scary because we know a certain percentage of those individuals are going to get very sick and potentially require hospitalization. And the averages are there's a small percentage of those that will also unfortunately perish from COVID-19. So we want to continue to see that number go down, not go up. COVID case data update also indicates that for last week, the positive COVID-19 test data was 10.8%. It was an increase of almost a full percent from the previous week of 9.9%, and the highest weekly positivity rate we've seen since May of 2020. The 30 to 39-year-old age category had the highest case total. We've seen this repeatedly in the last few weeks, though age groups under 14 years had the highest positivity rate of 13.5%. So unfortunately, children are the ones who have the highest rate of transmission in our county. We know kids can catch it in family settings, they can catch it in sports settings, and they can catch it in school settings. That's why masking of children is so important. Because even if a child has a very mild case or is asymptomatic, they could still pass it on to an adult in their family household that is much more at risk for a serious illness or death. And we do know there have been children in our community who have been admitted to a Shy Children's Hospital for COVID-19 and the serious illness that can result from it. So just because a child catches it does not guarantee that the child will have no illness whatsoever. The cases per zip code for the week ending December 4th, I don't have any good news to report. There is no part of Erie County that has good case rates. It's bad in the urban, suburban, and rural settings. It's going to be difficult for you to read this. You can find this information on our website. It will be released a little bit later today. But there's just ridiculously high numbers in communities. One part of the city of Buffalo, the 14203 zip code, had the highest rate as it pertains to its population. Basically, more than 1 out of 100 residents in that area had caught a new COVID case. The same is for East Concord in the southern part of Erie County. Eden, very high. Lackawanna, almost 1 out of every 100 residents caught a new COVID case in just 1 week alone. Lancaster, Wales, I mean, you look at it. Urban, just starting from the top. Urban, rural, rural, urban, suburb, rural, /suburb, rural, city, rural, suburb, suburb, rural, rural, suburb, suburb, city, city. So it's everywhere in Erie County when you look at these zip codes. And this is just those communities that had a rate of 600 or greater new cases per 100,000 people in the past 70 days. If you go through the whole list, it is very high. These are numbers we never would have believed 6 months ago, 8 months ago. We would have never believed that our community could have numbers this bad. It's bad. Hospitalizations, the hospitals are hanging on pretty much for dear life, but the numbers are continuing to trend upwards. COVID-19 patients increased 33% during the past 2 weeks. The hospitals are at or near capacity. I know ECMC's at full capacity. I believe South Buffalo Mercy, Sisters Charity Hospital's at full capacity. Bertram Chafee Hospital in Springville is 1 bed away from full capacity. Our total countywide is 90.6% of beds are occupied. When it comes to ICU beds, it's about 86%. On December 5th, there were 529 COVID-19 patients that were hospitalized across Western New York. That includes, for purposes of New York State's data, Niagara, Erie, Chautauqua, Cattaraugus, and Allegheny counties. It does not include Wyoming, Genesee, and Orleans. But there's 153 COVID-19 positive patients in these other facilities. At no time during the early parts of the pandemic did they have that many COVID-19 patients in their hospitals. They generally averaged 30, at most 50, and they've more than tripled that from the 50 to 153. So the hospitals are full all across Western New York. And as you can see from the number here, the line chart with regards to our hospitalization data since the beginning of the pandemic, Erie County is still a much lower rate than what we see elsewhere, or we saw earlier in the year, but I don't like the numbers and where they are at any one particular date. Actually, this is the wrong chart. I can see it because it's got the wrong date. We should be higher than that. So I'll just have to move on from that because I know we have more people in the hospital than that. We have, as this shows here, 376 people in the hospital. For whatever reason, this chart they didn't change the picture, but the numbers aren't great. The staff bed capacity is at 10% or less. Some elective procedures that were limited starting Thursday, December 9th, pursuant to an order from Governor Kathy Hochul, but they've already done that in a number of hospitals locally, including ECMC. They've already stopped elective surgeries for some time now. But effective December 9th, ECMC, Mercy Hospital in South Buffalo, Sisters Hospital in Buffalo, Mount St. Mary's in Niagara County, Brooks, TLC in Chautauqua, UPMC in Chautauqua, and Wyoming County Community will all have to stop elective surgeries. If you have an elective surgery scheduled for any of these locations, you should contact your doctor to find out if the surgery or when the surgery will be delayed until. These are elective surgeries. This does not include emergency surgeries or diagnostic routines that need to be done to determine whether somebody theoretically could need an emergency surgery. The vaccine update through December 6th, our numbers are still decent. We're not where we'd like to be, and compared to other urban areas in New York State, we are not anywhere where we should be. Our senior population has really taken it upon themselves to be vaccinated. More than 99% of the 65 to 74-year-olds in Erie County have received at least one dose. The 75 plus is a lower number. It's 90%, but that's because quite a number of those individuals, because of health issues, cannot get a vaccine. But we definitely have a really high rates of vaccination in the older population, but we don't necessarily have it in the younger population. It's good to see that nearly 1 out of 4 5 to 11-year-olds have received at least one dose, but that means 75% of children between the age of 5 to 11 have not. And we're roughly a little less than 2/3 of all 12 to 17-year-olds, but 1/3 of children have not. And as Dr. Burstein will talk a little bit more probably later, that's where we're seeing a lot of the cases in children are those that are unvaccinated. So we need to continue pushing those numbers up. Now, unfortunately, I have more sad news to report with regards to mortality data. The Erie County Department of Health has confirmed that 52 more Erie County residents have died from COVID-19 through December 2nd of this month. I certainly offer my deepest condolences to the friends and family of loved ones who've lost one at any time during this pandemic. We have just about not totally closed November yet, but we did not see the highs in November that we had of 2020 in general. But we saw more people die under the age of 60 in November of 2021 than we did in November of 2020. And I believe one of the reasons why our numbers are not as high as they were in November of 2020 is because of the vaccine. A large portion, over 60% of Erie County's population has gotten vaccinated. Over 70% of adults have gotten vaccinated. They're protected, but unfortunately too many people are not protected. And we have some vaccine effectiveness data that I think goes to show it. Of the 52 most recent county residents confirmed to have died from COVID-19, the average age of death for those who died that were fully vaccinated was 76. Many of these people have comorbidities. Not fully vaccinated, the average age was 61. And 4 persons under the age of 40 died in this most recent 52. All were unvaccinated. Here, a lot of people say, well, what were their comorbidities? What issues did they have? For some of these people, the only comorbidity they had was they were unvaccinated. They were not protected against COVID-19. And it is just so sad to see individuals in the prime of their life pass from COVID-19 who could have been protected if they had only gotten vaccinated. And to those families of the loved ones, you have my deepest condolences. This is a very sad time to have any death, especially during the holiday season, but you have the deepest condolences of our community on the passing of your loved one. Now I want to turn the podium over to Dr. Gail Burstein, who's going to introduce our special guest to talk about why we're dealing with these waves and what we can expect going forward as a community and a nation, because he is a national known specialist when it comes to infectious diseases. And as we know, COVID-19 is an infectious disease and the worst one that we've seen as a country in nearly 100 years. So, Dr. Burstein.
Thank you. So it is with great pleasure that I am introducing Dr. Tom Russo. He is professor and chief of infectious diseases at the Jacobs School of Medicine and Biomedical Sciences. I'm sure many of you have heard from Dr. Russo during this pandemic. He has been the voice of science in our community and the voice of smart guidance. So we're going to turn it over to Dr. Russo to give us, again, as the county executive said, a picture of what's going on here in our community and what we need to do to stay safe.
Thank you, Dr. Burstein, and thank you for inviting me here today. So one of the questions that I get asked frequently is, we're vaccinating so many people. Many people have already been infected. Why are we still having these waves of infection, including right now, arguably, one of the worst waves that we've experienced in this pandemic? So I sort of wanted to conceptualize this for you a little bit to understand what's going on, and therefore, if you understand why this is happening, what mitigation measures could be used to minimize the damage from COVID, which has obviously been devastating to Western New York and our country and the world. The easiest way to look at this is who is susceptible to getting infected, and those susceptible individuals when they're exposed to the virus. So let's start with the susceptibility group, because I and many people thought over time, as we vaccinated more and more people, and unfortunately also some people get infected, which confers a degree of immunity, the susceptibility group would diminish over time. But unfortunately, this is probably not happening now for a few reasons. So our susceptibility group still remains those who are yet to be vaccinated and have never been infected. They have no immunity, and they're extraordinarily at high risk for both getting infected and having a bad outcome. However, individuals that were previously infected that feel they're good, because there's lots of talk of immunity from prior infection, if you were infected in the pre-Delta waves, back originally in March and April, and the sort of holiday surge about almost a year ago, there's some waning of that protection, and your susceptibility is increasing. Likewise, for those that were vaccinated early on and have only received 2 shots to date, though to a lesser degree, there's some waning in that immunity. So, as opposed to our susceptibility pool shrinking, we're actually having an expanding pool where the virus then could find these individuals and cause infections. Now, how does the virus interact with these individuals? How are these individuals exposed? Because obviously, if you're susceptible and you're a hermit and you're never exposed, you're going to be safe. But unfortunately, life doesn't work that way, and all of us have to interact with individuals, whether it's at home or at work or in various public venues. So, first and foremost, the Delta variant. The Delta variant is extraordinarily infectious. So everything being equal in earlier waves, when you come in contact with someone that's infectious and you're susceptible, the likelihood of you getting infected is much greater. In fact, individuals shed 100 to 1,000-fold more virus of Delta than they did with the Alpha variant. Secondly, when July rolled around this year, Delta hadn't shown up to crash our summer fun here in Western New York. We all took a sigh of relief and says, we're on the backside of this. We've been a bit recluses. We hadn't been getting together with our friends. We were starved for social interactions. And really, since July, we've been operating kind of in pre- or post-pandemic mode. We've been interacting with our friends. We've been involved with interactions that are much riskier than early phases in the pandemic where everyone is really careful. We've really let our guard down, and though obviously certain individuals that continue to be extraordinarily vigilant and protect themselves, our behavior overall is what I like to say has been less than excellent. And then perhaps a most important factor, although when Delta showed up, we saw a moderate number of cases in the summer due to some susceptibility and those increased interactions. As the cool weather set in here in Western New York, we headed indoors. And we know that's where the virus spreads extraordinarily well. And that combination of an expanding susceptibility pool, indoor activities where people aren't as careful as they used to be in terms of interacting is really leading to this extraordinary surge of cases. So, what can we do to protect ourselves, try to dampen the number of rising cases? We certainly don't want to overwhelm our healthcare systems. We know if we overwhelm our hospitals, and we're on the cusp right now, that not only people infected with COVID will have worse outcomes, but people that are in hospital for non-COVID diseases will also have worse outcomes because of the stress on our healthcare providers and staff. So, first and foremost, to decrease that susceptibility pool, the best way to do that is if you're yet to be vaccinated, please get vaccinated. And if you've been vaccinated but have only received one of the 2 shots for Pfizer or Moderna, please get that second shot. And if you're eligible for a booster, please get that booster. I don't think we've been letting people know how important that booster shot is in augmenting your degree of protection. And just to give you some numbers, compared to the maximal degree of protection that you had after the first 2 shots, if you receive a booster shot with either Pfizer or Moderna, the levels of protective antibodies will increase at least 10 to 20-fold. So you'll have a huge degree of protection, an extraordinary buffer, and I think that's really going to help us tamp down cases. So obviously, first and foremost, vaccination. Secondly, to increase exposures when you're in public-facing venues, please wear a mask. If you're infectious and wearing a mask, you'll minimize the chances of exposing others to the virus. And keep in mind that people can feel perfectly well, be asymptomatic, either for the total duration they're infectious, or be asymptomatic for a few days before they develop symptoms, and still be able to spread that virus. And so asymptomatic spread is critical. Obviously, though, if you have symptoms and you don't feel well, also stay home, right? And because get tested, because people that are symptomatic and going out and interacting with others is also going to drive cases upward. And lastly, I know we're all starving for social interactions. We're in this most important run of Thanksgiving, the religious holiday, and New Year's, and we're really desperate to get together with our friends. But please, use good judgment in terms of getting together. Don't put yourselves in risky situations, particularly indoors, where there's likely to be infectious people when they're not wearing masks, and that usually when food and drink is involved, obviously we can't wear masks. And that's why vaccination is the ultimate mitigation measures. Love masks. Masks are great, but you cannot wear a mask when you're eating and drinking, and therefore the importance of vaccination, which works for you 24/7. So let's gather ourselves, everyone here in Erie County and Western New York. This Delta wave is extraordinarily problematic, and it's sad the toll it's taking on our community. And maybe leave you with one last thing. Remember, doing all these sorts of behaviors in terms of getting vaccinated, wearing masks, minimizing risky behavior, though obviously it's beneficial for you, remember, when it comes to public health, it's not all about you. We're in this together. And if you're someone that's infectious and have not taken the appropriate measures, you're putting others at risk. So doing the right thing not only is beneficial for you, but it's extraordinarily beneficial for our community. And I'd like to think here in Western New York, we're extraordinarily community-oriented. We help each other out. We pull together. So let's not let our guards down, and let's do so and try to put this pandemic to an end. And let me stop there.
Thank you, Dr. Russo, and thank you for putting into perspective about our transmission dynamics in our community and really spelling out what we can do to not only keep ourselves safe and healthy, but also the rest of our community safe and healthy. So now I'm going to move on to what the Erie County is doing to keep people safe and healthy. So when we last convened last week, if you recall, the Buffalo Public Schools had learned, as had we learned at the same time, that their testing vendor was no longer going to be able to provide the Buffalo Public Schools with their COVID-19 screening testing. So we welcome them into our Erie County screening testing program. So they will be one of the other school districts that we have been successfully offering screening testing to students and staff. And the Buffalo Home Care is who is the company that is collecting the specimens for all our schools, is also going to be doing this for the Buffalo Public Schools. And Quadrant Biosciences, which is a great lab that is running the PCR testing for our school testing program, is also going to be running the tests for the Buffalo Public School program. So the Buffalo Public Schools is in a good place, just like all the other schools in Erie County, for having good access to surveillance testing and identifying positives in the school to prevent transmission. We're also targeting vaccinations in the Buffalo Public Schools. Vaccinations in the public schools is a priority for Erie County and the rest of the rest of the city of Buffalo. So we're not only partnering with the Buffalo Public Schools, we're also partnering with Connect, which is a great community health worker organization, and we've been very successful in delivering almost 1,000 vaccines to Buffalo Public Schools students, staff, and family members since August of 2021. And I can't emphasize the importance our community health workers have been in this endeavor to get everybody in the Buffalo Public Schools vaccinated. They've been going out in the big community. They've been pounding the pavements. They've been knocking on doors. They've been reaching out, looking at, they're a valued source of information in their community, busting those myths around vaccines, educating people, and getting them even excited to come in and get vaccinated at our clinics. And then also at the clinics, making them fun, offering education and making them big general wellness events, not just COVID-19 vaccine clinics. And this has been a successful model, partnering with our Buffalo Public Schools, using our community health workers, our valuable asset. And we're going to continue doing that through the rest of the pandemic. And actually, just in the past month, we've delivered almost 800 vaccines to our Buffalo Public Schools students, families, and staff. So we've been very productive, even though the weather has turned cold. So we are scheduling additional Buffalo Public Schools vaccine clinics on the weekends, in the evenings. We really want to make these accessible not only to the students, but also to their families, to parents and siblings who are 5 and up. So we're really trying to get out in the community. And again, our community health workers are happy to make that happen. And I just want to clarify, there's been a little bit of confusion. We know that initially the Buffalo Public Schools requested 10,000 doses of COVID-19 vaccine from the state. However, the Buffalo Public Schools is not receiving any doses of COVID-19 vaccine from the state. We are working with the Buffalo Public Schools vaccine clinics just like any of our vaccine clinics. We're using our supply that we order from the state to vaccinate our Buffalo Public Schools students, staff, and families. So the Buffalo Public Schools, we're really excited to work with them, and this partnership with our community health workers is making that happen. We also have new vaccine sites throughout the community. Again, we want to make sure that every single person in Erie County has access to a COVID-19 vaccine. As Dr. Russo and the county executive mentioned, this is our key out of the pandemic. This is what's keeping us safe and healthy, and it's very critical that we all get that third dose, if possible, before we all convene in the Christmas holiday. So yesterday, we were out at Ellicott Peak Park in Tonawanda. Today, we're very, very busy at the Delavan Grider Community Center. Tomorrow, we're going to be at Chestnut Ridge Park in Orchard Park. Thursday, we'll be at Elmo Meadows Park. And then this Friday and next week Friday, we'll be at the Orchard Park Fire Company. And so during our clinics that are open from 11 a.m. to 7 p.m., we offer every single vaccine possible, except we have like a little bit of a shortage of Johnson & Johnson. We have all the Pfizer, all the Moderna. We can get anybody vaccinated with any dose that they need, ages 5 and up. So bring your families. Please, it's very important that you make an appointment. You can either give us a call at 716-858-2929, or what's very easy is go to our vaccine website at erie.gov/vax, V-A-X, and make an appointment yourself. You can choose the time, the place, and to get a vaccine. So we also do take walk-ins at our clinic. However, we do give priority for vaccination spots to our appointments. So people who walk in, we will vaccinate you, but you might have to wait a little while. Our clinics usually slow down at the last couple hours of the clinic. So if you're going to be a walk-in, I strongly encourage you to come in the last couple hours of the clinic. So that would be between 5 and 7. We also have some new brick and mortar vaccine locations. Again, vaccinations are a priority for us at the health department. We still have our vaccine site in Orchard Park at SUNY ECC South that is open Monday through Friday from 12 to 4, except on Wednesdays we're open till 7 p.m. We're also partnering again with Buffalo Home Care to offer brick and mortar vaccine clinics. We have 2 locations, first at their 490 Delaware Avenue site in the city of Buffalo, and then they opened up a new location this week out in East Amherst at 5847 Transit Road. So that's right in the thick of all the shopping plazas and where the restaurants are. And so on your way to pick up a gift or run some errands or go out to dinner, get a vaccine. That should be on your do list. So Buffalo Home Care is, they're open for their vaccinations weekdays between 9 and 8 p.m. And then on the weekends, they're open between 9 a.m. and 5 p.m. So please think about one of these sites to get a vaccine. And if you don't feel like going out to get a vaccine, we can have the vaccine come to you. Again, we are working with Buffalo Home Care for our Vax Visit program. Again, you can schedule on our Erie County vaccine website at erie.gov/vax, V-A-X. You can also call us at 716-858-2929. We'll take in your information, we'll give it to Buffalo Home Care, and then they will contact you to find out when is the best time to come to you to get you or anybody in your family, 5 and up, a vaccine right in the comfort of your own home. If none of these are good options for you, you can go to the vaccines.gov website and find other locations in our community where you can get a vaccine. Also, many of our community physicians, especially our pediatrician's office, are offering COVID-19 vaccines to their patients. So talk to your healthcare provider, especially for your kids, if you want them to get vaccinated. And then also, it's so important that people get tested. It's very important that people know their status, because if you know your status, you'll know that you need to stay isolated from everybody, and that's how we break the chain of transmission of COVID-19. And with the Delta variant, as we mentioned earlier, people might have just like minor symptoms, just like the sniffles. You might think, oh, this is something that happens every time this year, or it's in my allergies, or it's sinus. I get sinus every year, but you don't know unless you get a test. So even if you've been vaccinated, we can still get COVID-19. However, you won't be as ill, and hopefully you won't end up in the hospital, but you can still get infected and you can still transmit infection to others. So please give us a test. Just give us a call at 716-858-2929. We offer free diagnostic testing to any Erie County residents. Our PCR test, which is the gold standard of COVID-19 testing, test results are available between 1 to 3 business days. Usually we're able to get them out in 1 to 2 days, the results. And then we're also offering point-of-care molecular diagnostic testing to K through 12 students and staff who are symptomatic to help them get back to school faster. So I just want to remind everybody that every single positive specimen that we get, we send to the University of Buffalo to Jennifer Surtees at the Genomics Center of Excellence to conduct the genomic sequencing. So we are looking for that any of those new variants in our community. So again, you by getting tested, you'll not only know that if you are infected, you'll know your status, you'll know the prevention measures to take. However, you will also be contributing to our knowledge of what variants that we may have in our community. So I'm going to turn it over to the county executive to field questions for the county executive or me or for Dr. Russo. Thank you.
Thank you, Dr. Burstein, as always, and thank you, Dr. Russo, for being here and offering that excellent explanation about why we are seeing increased numbers of COVID-19 now, and it is all due to the Delta variant and how transmissible it is. So with that, I am going to, we're going to open up the phone lines to our friends from the news media, and we will start out with B News, Emily Stoll.
I don't have any questions right now, thank you.
Okay. Is anybody on from the Buffalo News?
Yes. Hi, Mark. It's Sandra Tan. I had 2 initial questions. One is, do you have any sense as to why Erie County has a higher rate of infections than many other counties? If you look at the infection rate per 100,000, it's one of the highest across the country. And there are other counties that have lower vaccination rates and fewer restrictions than Erie County has. So I didn't know if you had any insight to that. The other question I had is regarding the effectiveness of wearing masks. We've been hearing from folks who said, look, masks don't work. The number of infections and positive rates continue to climb despite the fact that you've imposed mask wearing requirements. I don't know if you or Dr. Russo could speak to that.
Well, I'll turn it over to Dr. Russo to go in greater detail, but First off, I don't know when you say you're comparing the country, there's apple to oranges comparisons here. You can't compare New York State to Florida, Arizona. We can look at what's going on in Monroe County. We can look at comparable areas in the Great Lakes where it's a little colder out. It's like the summer when in Florida everyone's inside and they're in air conditioning. Their rates were astronomical, and ours were better because people are outside. Now their people are outside, and our rates are higher because people are inside. So I think you have to be careful when you say nationally, because just the differences in the country, differences in vaccine rates. I will note that we have not seen a tremendous growth in the positivity rate in the last 2 to 3 weeks. We have seen a lot of new cases, but the positivity rate has pretty much stayed in that 9 to 10% category, unlike other counties in the Western New York region, which have seen 12, 13 or higher on daily rates and sometimes even weekly rates. So I do believe the mask is making a difference in preventing the further spread and watching our positivity rates go even higher. Just my own opinion, and I'll turn it over to Dr. Russo and Dr. Burstein. You would normally expect to see the positivity rates be much higher in Erie County than in the other counties, just because we have a much more dense county. We have 953,000 people plus that live in Erie County, as compared to some of the other counties in Western New York where it's like 60 or 70,000. And their population per mile is very small compared to ours being a much more dense population. So I think you would normally expect to see the positivity rates higher in Erie County because there'd be greater chance of transmission with so many people, but in fact they're actually lower than what we're seeing in the other counties that actually have a lower vaccination rate. So I'll turn it over to Dr. Russo if you'd like to add anything, or Dr. Burstein, but I do believe the mask requirement is making a difference.
So let me be clear. Masks work, but masks are only as good as the quality of mask you have and whether you wear it and use it. So let me give you both a conceptualization and an example. So presently we have a mask mandate in public-facing venues here in Erie County. Let's say someone yesterday went out and bought supplies for the Bills game. They were asymptomatic, they were unvaccinated, they were infectious. But when they went into Wegmans or Tops, that mask actually prevented infectious particles that they were breathing out from entering into the air, and other people in those grocery stores, by wearing masks, also, if a few particles escape, because masks are not perfect, we're able to then to block those particles from infecting them. Then that person goes home and invites a bunch of their friends over, and they're eating and drinking without masks. And guess what? A bunch of those individuals are going to end up getting infected. So masks unequivocally work if properly used, but one needs to be judicious and carefully think through what situations you may be in that will pose an increased risk, and use masks appropriately. Dr. Burstein, I don't know if you want to add anything onto that relatively simple but hopefully self-evident explanation.
Thank you. Well, Sandy, you know what's really killing people and causing great transmission of COVID-19 is misinformation. And masks don't work is one of the biggest pieces of misinformation in this pandemic. Masks work. There are scientific data. There's anecdotal data. There's just because somebody says masks don't work doesn't mean that it's true. We have data to show that is true, and since we've implemented our mask mandate in Erie County, our COVID-19 numbers are much lower than surrounding counties that have not implemented a mask mandate. And as Dr. Russo mentioned, masks are one of the strategies to reduce COVID-19 transmission. There's not just one particular strategy that will stop disease transmission. We need to use all the non-pharmaceutical interventions like masking, distancing, trying to be outdoors as much as possible, and our key pharmaceutical intervention, which is vaccination. We have to use a layered approach and use all these interventions to be able to stop transmission, not just one. And masks work. Thank you. And I'll turn it over to the county executive.
Thank you, Dr. Burstein. We'll go next to WBFO Radio. Michael Moroziak's on.
Good afternoon. Hey, good afternoon, Mark. The town of Grand Island's board voted last night to pass a resolution disagreeing with the county's mask mandate. They've just become the latest. Marilla, West Seneca, the village mayor in Williamsville, Mayor Rogers there, have all expressed opposition to the mask mandates. Talk about the obstacle that poses when leaders of these townships are saying, hey, we don't agree with these mask mandates. And does the county consider when they hear this that it's time to maybe step up the efforts of sanitarians?
Well, our sanitarians are going out across all of Erie County, including communities where maybe their elected officials say they're not welcome. But as we don't tell the town of Grand Island and Marilla how to collect its garbage, because that's their responsibility, it is the responsibility of the Erie County Department of Health to provide the health care coverage and sanitarians that do inspections of restaurants and bars, so we are going to continue to do that. I would note, from what I've heard from a number of the businesses in these communities with elected officials who are saying they don't believe that the mask requirement should be in effect, the businesses have come out and said that's actually hurting their business by their elected officials saying that, because now people don't want to go to that business thinking that they're not going to have people wearing masks, when it's actually the opposite. I know that happened in Williamsville and the town of Marilla. I heard evidence in the town of West Seneca, to the point where the town of West Seneca supervisor seemed to have backtracked and said, no, he understands the need for masks, and then started focusing on the hospitalizations, which is something we've been focusing on for quite some time. I'm always reminded of the phrase that former Senator, the late Senator Daniel Patrick Moynihan, said, which is totally appropriate in this situation. You're entitled to your own opinion and not entitled to your own facts. And the facts are such that COVID-19 cases in Erie County are at an all-time high. Deaths are at a rate they should not be based on our vaccinations, because there are so many people who are unvaccinated who are dying that shouldn't die. As I said, in this most recent grouping of 52 individuals who perished due to COVID-19 in the most recent week or so, 4 of them were under 40, and they were all unvaccinated. It's fair to say that if they were vaccinated, I think we'd have most of those people here today. Elected officials, public, you're entitled to your own opinion, but you're not entitled to your own facts. Masks work. Masks protect against the spread of COVID-19 and what is really a horrible variant, the Delta variant. We're not even talking about Omicron. We're just talking about Delta. And it is spreading in some communities like wildfire, where more than one out of every 100 residents on a weekly basis has had a new case. I think we all know people who've caught COVID-19 in the last few weeks. And unfortunately, we may know individuals who've perished. So to the other officials, I think they're doing a disservice to their community, and they're probably hurting businesses, because people don't want to go travel into communities where people think they're going to be at risk for COVID-19. And I know that to be the case in Marilla, Williamsville, and West Seneca, where businesses from those communities reached out to my office and said, we're wearing masks. We're requiring masks because we know it's the right thing to do. And we're disappointed our elected officials said otherwise, because now people are calling saying, I'm going to cancel my event that we had scheduled at your restaurant because we don't want to be around people who aren't wearing masks. So to the other elected officials, I want to thank Supervisor Joe Eminger in the town of Tonawanda and Supervisor Brian Culpa in the town of Amherst, 2 of our largest communities, for coming out in the last few days and saying it is important that we get vaccinated. It is important that we wear masks until we can get through this really nasty wave. So there may be a few out there who are criticizing it, but the vast majority have supported it, and they understand why, because it protects against the further spread of COVID-19, which means it protects against further death. WBEN Radio, is anyone on?
Hi, Mark. I'm here. Tom Puckett here. Mark, the Test to Stay is currently going on in Grand Island. Monroe County is now offering Test to Stay in all school districts. Why is that not being expanded to Erie County?
The Test to Stay program is a pilot program that is going to run through the remainder of this month in the town of Grand Island School District. That is, of course, not recommended by New York State's Department of Health. They do not recommend the Test to Stay program, but we are doing a pilot to see if it works. The first day's data showed that all the individuals who were tested came back negative. I don't know if you have the next day's data or not. No, we don't have the next day's data. But we want to make certain that if we're going to implement a Test to Stay program in our entire community, we first off have to work with the school districts to do that, but we want to make certain that it is safe, because we do not want to create an environment where we think we're having children who are unfortunately staying in school but are COVID-19 positive. And as we talked about, there's a significant percentage of new cases in children across our county, and the percentage rate of new cases as a positivity rate was highest in the ages of 14 and under in this last week. So we want to be safe, and we don't want to rush and do something that theoretically could backfire and then see that a whole classroom or a whole school is closed. And it's my understanding that a small school, universal school, actually closed its entire campus in the last week due to COVID-19 outbreak among many of its students. Spectrum News. Anybody on from Spectrum?
Yes, Brianne Rozier here. According to data, it shows that there is the potential that vaccine mandates in New York City are proving to be effective. Are you agreeing with that? And do you feel like we might be approaching phase 2 of your COVID response plan?
Well, I've always said that when it comes to the increasing phases, it's going to be dependent on a number of things. We needed to have a substantial amount of data to show whether the mask mandate was making an effect. We think it is. We also, of course, the most important thing we're looking at is hospitalization rates. We have to keep the hospitals free so that they still have beds for individuals who need it, whether it's a car crash or a serious illness. Kathy Hochul, our governor, certainly took important steps in this last week by implementing a ban on elective surgeries if a hospital had more than 90% of its beds full. And she also has sent National Guard troops to various locations in Western New York to help offset some of the problems that we're seeing, including in nursing homes. I know the Terrace View Nursing Home Facility at the ECMC campus received National Guard troops yesterday to help open up more beds at the nursing homes so that individuals could be moved out of ECMC into the nursing home if they no longer need acute or direct care because they're not sick. They just may need nursing care because they can't live on their own. So a lot of actions have been taken, and we set December 13th as the date to review all the data to determine if we needed to go into phase 2. We haven't seen a big change in the overall hospitalization percentage. It's been about the same since we announced the mask mandate. We haven't seen a huge change in uptick in the positivity rate since we instituted the mask regulation, and I think that's a combination of many things. The mask regulation, as well as, of course, the higher vaccination rates. And one thing I will note, I was looking at the data from last week with regards to new vaccinations in Erie County. They're up, including individuals getting their first dose. Adults, not just children, adults. People are getting vaccinated. I think they realize the severity of the situation, and they're not taking any chances. They may have waited a long time. Maybe they know someone who died from COVID-19 who was unvaccinated, and now they're saying, you know what, I'm going to get vaccinated. That's all part of it. We need everyone to come together. Just like our grandparents or great-grandparents came together in World War II, we need everyone to come together to get vaccinated and wear a mask against an unseen enemy, the COVID-19 virus. Next question to Channel 2 News.
Yeah, good afternoon. Early on in the pandemic, we used to see the rate, positive rates in Erie County would be higher than, let's say, in New York City, and then they would get higher than we were, and it kind of went back and forth. Now, consistently, we're seeing the rate in New York City real low, and they have their own health department. different in terms of, let's say, their PCR tests and their CT cycle threshold? I mean, are they assessing their stuff differently? Because you could say, well, they have stricter mandates and vaccine mandates. Before you say that, I just point you back at Florida where they don't have these mandates and their rates are lower. The question is, do we analyze PCR tests in terms of cycle thresholds or anything like that any different here? And might that explain why we're consistently higher as opposed to before, where we used to kind of go back and forth in terms of rates?
I'm going to turn it over to the doctors to do more of the specifics, but I'm going to note right off the top that they have a much higher percentage of individuals who are vaccinated and wearing masks. They went through hell. They just went through hell. And I think people are, in some ways, are dealing with PTSD associated with it, and they don't want to go through it again. But I'll turn it over to the doctors to go into a little greater detail.
There's no difference in PCR tests in terms of whether it's positive or negative. Cycle threshold gives us perhaps a sense of how much virus is there, but it's treated the same everywhere in this county, in the state, and across the country. So it's either positive or negative. And, addressing the situation downstate, it is a combination probably of slightly higher vaccination rate, more rigorous behavior, likely due to what they went through previously. They don't want deja vu all over again. And it may be contributing to a degree, it is a whiff warmer downstate, or at least it was a couple of weeks ago than it was up here. And so they're now starting to get some of that cooler weather and head indoors, and their rates are also ticking up a bit as well. So I think a combination of those factors. But at the end of the day, more vaccines, better behavior, better mask usage is definitely going to tamp cases down. And remember, when we get to this high level of cases, it becomes like a snowball effect. When you start low, there's only a few people that, when they get together, might be infectious. But if you have lots of cases, the likelihood of someone being infectious showing up to the party is much higher. And so keeping things low has a very positive effect. Where you're at right now here in Western New York, the snowball effect is happening, and that's why we really need to up our game, be more rigorous to try to turn the corner on this and drive cases downward, and that's obviously going to help us then minimize cases moving forward.
Thank you, Dr. Russo. Next, Channel 4, George Rickard there.
Hi, Mark. The terminations are finally taking effect this week at Catholic Health, and Kaleida are losing hundreds of employees this week from the vaccination mandate for healthcare workers. It amounts to about 2% of the Kaleida workforce and about 2% of the Catholic Health workforce being lost because of refusal to get the vaccine. Is that about what you expected? And what kind of impact do you think losing 2% will have on the overwhelmed hospitals?
Well, I don't know the exact numbers associated with Kaleida and Catholics. I have not been in direct contact in the last couple of days with their CEOs. I do know from the CEO of ECMC that they had approximately 140 individuals that were claiming a religious exemption, and a majority of those individuals actually have been vaccinated. So it's less than half of those individuals. I would leave it up to ECMC to reveal the full number who actually would be at risk of losing their position. I've said all along, I think vaccine mandates in the healthcare setting make sense. We do know, especially as it pertains to nursing homes, and remember, we're also talking about nursing homes, not just the hospitals, that many of the illnesses and deaths that were caused among nursing home patients last year were brought in by the staff who were positive and were sharing it with the residents that they were taking care of because they didn't know they were positive. They were asymptomatic. As Dr. Russo noted, you could be feeling perfectly fine, not realizing that you're COVID-19 positive and shedding the virus, and that's what happened in a lot of the nursing homes last year. So, of course, a number of things were instituted, including testing and now the vaccine mandate. I'll leave it up to the other hospital systems to talk about how many employees elected not to get vaccinated, but I just think my personal belief is if you're working in the healthcare field, you'd want to protect yourself from a deadly disease that has taken more than 2,000 lives in our county alone and almost 800,000 nationwide. It's just very sad that we've lost so many people, and I would hope that all will get vaccinated regardless of what their profession is, because it'll protect you. WKBW TV, Channel 7.
Yes, I have one question. My second one was already asked earlier. So what do you have to say to the city and town officials within the county for opposing to implement mask mandates within their municipalities?
I already answered that question, but I will note once again that these officials have no power whatsoever to change that. The Erie County Department of Health is the duly authorized entity with regards to inspecting of restaurants and bars and other facilities, as well as ensuring the safety and welfare of our community. There are no town or city departments of health. They don't have them by law. Maybe this is one of the reasons why, but they do not have them. The city of Buffalo does not have a Department of Health, but the Erie County Department of Health is the provider for our greater community. And we will continue to provide and protect our residents from a very deadly virus that is still taking lives in our community, far too many lives than we should have seen lost, but unfortunately have, because so many people in this most recent Delta variant died from when they weren't unvaccinated. Any other media outlets that I see? We have a WRGB from Rochester. Brianna, are you still there?
Yes, I have a question about that. So I think a similar question was asked earlier, but just to reiterate, New York City was once the epicenter of the pandemic, and now they're seeing some of the lowest positivity rates in the state, and they even forced vaccine mandates, the most recent one announced yesterday for private sector workers. So I guess my question is, do you think adopting such policies in Erie County is needed to bring down the number of cases as well as the number of deaths?
Well, we have a four-phased approach here in Erie County, the first being the mask regulation for all indoor public locations. Then, if we need to, we would implement a vaccine mandate. Then, of course, the next level would be restrictions on capacity, and finally, phase 4 would be shutdowns. We do not want to get past phase 1. We're analyzing the data. Right now, we are going to continue to analyze the data. We set December 13th as the initial date so that we had basically 3+ weeks of good data to look at to determine if we need to take further action. It's very difficult to compare region to region. You can look at positivity rates, but you also have to understand New York City region, Long Island, Westchester County, they have much higher vaccination rates than we have in Western New York, or for that matter, in the Rochester area. Much higher. And I think it's important that that needs to be talked about and what they went through. So we need to understand that there's a totality of the circumstances, with the hospital rates being the key as to whether or not we go to another phase. And that will be decided upon in approximately a week. Final question, I don't want to leave you out. Olivia Dance, Fox 29. Sorry I didn't get to you earlier. I just saw your name down there.
No worries, County Executive. Yeah, my question was kind of going along with some of the other questions you've answered about enforcing the mask mandate. You know, is the county concerned at all with some of these protests we've seen against the mask mandate? You know, there's some protests planned for in Erie County schools later this week. So is that a concern, and how is the county handling that? Thank you.
Well, our County Department of Health, of course, is always dealing with our school districts. We have a lot of conversations. We have an entire team dedicated to the schools in the Erie County Department of Health epidemiological staff. I believe we're the only upstate county to do that. We have a school team. That's all they focus on in schools. And we know it's important that people wear masks, especially in a school setting. We want to keep the rates down among children who then themselves could get sick or pass it on to others. So once again, I just reminded of Senator Daniel Patrick Moynihan's famous phrase, you're entitled to your own opinion, you're not entitled to your own facts. Masks work. Vaccines work. They save lives when they're worked in tandem together. Please wear a mask. Please get vaccinated, and you will help us all get through this a lot quicker. With that, we've reached an hour. I want to thank everyone for participating in today's press conference. I want to thank Karen Gambino from Deaf Access Services for the hardest working person in the last hour in Western New York. She'll deserve a rest after this. And to all, as always, if you haven't been vaccinated, get vaccinated. If it's been more than 6 months since you've been vaccinated with the Pfizer or Moderna shot, get a booster. As Dr. Russo noted, your protection will be so much greater. If it's been more than 2 months since the Johnson & Johnson shot, get a booster. And when you're out in public, regardless of whether or not you've been vaccinated, wear a mask. You can protect yourself, but more importantly, just as well, you'll be protecting everyone around you, including your loved ones, during this wonderful holiday season. Take care all, be safe and well.